A study enrolled 80 patients with persistent atrial fibrillation, and it was conducted to evaluate if the acupuncture had any effects on the recurrence rate and whether it was able to prevent arrhythmias. After patients had their normal heart rhythms restored via cardioversion, they were treated with amiodarone, acupuncture, sham acupuncture, which is a procedure where the needles are inserted in the wrong points, or they were given no treatment. The results revealed the recurrence rate was lower in the acupuncture group, 35%, than the sham, 69%, or the control, 54%. The recurrence rate in the patients treated with the amiodarone were 27%. So analysis of the data from 8 separate studies showed an 87 to 100% of participants converted to the normal heart rhythm after the acupuncture treatment. The Mediterranean diet has shown to provide cardioprotective effects. A study conducted in 2011 sought to study the relationship between this type of diet, vitamin intake, and the incidence of arrhythmias. The study recruited 800 subjects, 400 of which had detected their first episode of atrial fibrillation. Low adherence to the diet was associated with the development of atrial fibrillation, and high adherence with spontaneous conversion back to normal electrical impulse in the heart. While further studies in a larger population are required to corroborate these findings, a high adherence to a Mediterranean diet may potentially prevent atrial fibrillation episodes. Other lifestyle measures that reduce the risk of arrhythmia include adequate exercise, maintaining a healthy body weight, quitting smoking, cutting back on caffeine, cutting back on alcohol, reducing stress, and avoiding stimulant medications. The omega-3 fatty acids, EPA and DHA, are important health-promoting lipids, and are found in certain fish and seafood, as well as some marine plants. In addition to their well-known anti-inflammatory effects, EPA and DHA also have anti-arrhythmic properties, and they've been found in multiple studies to benefit heart disease patients by improving lipid profiles, lowering blood pressure, and reducing the risk of sudden death. Omega-3 fatty acids can help to regulate the heart rhythm by normalizing sodium and calcium channel function in the heart muscle cell membrane, thereby stabilizing the electrical activity. In a randomized crossover trial, where the subjects participated in both treatment and placebo group in separate phases in random order, that included 87 patients with implanted cardioverter defibrillator who were supplementing with 3.6 grams of EPA and DHA per day for 6 months, it reduced the number of the ventricular arrhythmia episodes. The average number of episodes was 1.7 during the EPA and DHA phase versus 5.6 during the placebo phase. Another trial in 115 heart attack patients found 1.8 grams of EPA daily for 1 month, beginning 1 day after the heart attack, reduced the likelihood of ventricular arrhythmia. The incidence of ventricular arrhythmia was 7% in the EPA group and 20% in the control group. A control trial in 80 patients with known heart disease already using anti-arrhythmic drugs found adding 1 gram of omega-3 fatty acids daily for 6 months further reduced the number of the ventricular arrhythmia events. The effects of omega-3 fatty acid supplementation on atrial fibrillation risk appears to be more complex. A report from an ongoing observational study that included data from 6,546 participants who had no cardiovascular disease at the beginning of the study found those with the higher baseline levels of DHA, but not EPA or EPA plus DHA, were less likely to develop atrial fibrillation over a median of 14 years of monitoring. On the other hand, some clinical evidence suggests taking EPA or EPA plus DHA supplements might increase atrial fibrillation risk. A meta-analysis of 5 randomized placebo-controlled trials, which combined a total of more than 50,000 participants, all of whom had established a high risk of cardiovascular disease, found omega-3 fatty acid supplementation was associated with a 29% increased incidence of atrial fibrillation, despite reducing the risk of cardiac events in some of the trials. It's important to note that the trials in the meta-analysis were designed to identify a relationship between omega-3 fatty acid supplementation and major cardiovascular events like heart attack, stroke, heart failure, and cardiovascular death. And atrial fibrillation incidence was reported as a secondary or tertiary outcome. One trial included in the analysis had 8,179 participants with established or high risk of cardiovascular disease, and it compared 4 grams of specialized EPA with no DHA daily with a mineral oil placebo. During a median of 4.9 years of monitoring, the incidence of cardiovascular events was significantly lower in those who were receiving the EPA, but the risk of atrial fibrillation was noted to be higher, at 5% versus 3.9%. Another trial in the analysis that included 13,078 participants found 4 grams daily of a specialized formulation of EPA and DHA had no effect on cardiovascular events compared to corn oil placebo, but it was linked to an increased rate of reports of new atrial fibrillation at 2.2% versus 1.3%. In a third trial, 12,513 participants were given 1 gram of omega-3 fatty acids daily in their naturally occurring ethyl ester form or an olive oil placebo, and they were followed for a median of 5 years. The ratio of EPA to DHA in the supplement ranged from a 0.9 to 1 to a 1.5 to 1. No significant difference was found in the occurrence of the atrial fibrillation between the groups. In women, hospitalization or death due to cardiovascular events was reduced. The 2 other trials in the analysis found no statistically significant increase in atrial fibrillation, with combinations of EPA and DHA at doses of 1.8 grams and 840 milligrams per day, and no significant effect on the risk of cardiovascular events. In contrast, a randomized control trial included 25,119 participants aged 50 and older without cardiovascular disease, and it found 840 milligrams of omega-3 fatty acids, being 460 milligrams EPA and 380 milligrams DHA per day, in their ethyl ester form, did not impact the incidence of atrial fibrillation compared with a corn oil placebo during a median of 5.3 years of follow-up. And furthermore, a meta-analysis of 14 randomized control trials with a total of 3,570 participants found supplementing with EPA and DHA reduced the risk of post-operative atrial fibrillation after cardiac surgery compared with the usual care, but not compared with other oils, and only when the dose of DHA was higher than the dose of EPA. Further research is needed to explore the possible protective role of DHA and to establish the optimal dose, form, and ratio of omega-3 fatty acids to prevent or to treat atrial fibrillation, and identify characteristics of patients who are most likely to benefit from omega-3 fatty acid supplementation. Until more is known, it's recommended patients with a history or high risk of atrial fibrillation only use omega-3 oil formulations that include DHA, and they use a moderate amount, less than 4 grams per day. As both magnesium and potassium are intricately involved in the heart's electrical stability, maintaining the normal function of the blood levels and the ratios of each of these ions is important. Low concentrations of magnesium and potassium in the body are associated with an increased risk of developing ventricular arrhythmias. A magnesium deficiency can result in congestive heart failure, hypertension, and angina. The American Heart Association recommends administering magnesium sulfate intravenously at up to 2 grams in 2 minutes to treat some types of ventricular tachyarrhythmia. Oral magnesium oxide at 15 milligrams per kg, added to a regime of beta blockers, help to improve some of the markers of imminent ventricular tachyarrhythmia, even in cases where the beta blocker failed to make a difference on their own. Additionally, oral magnesium at 3 grams a day for 30 days improved the symptoms of premature ventricular and supraventricular complexes in 93% of the patients taking magnesium, when compared to only 16% of the patients administered the placebo. Potassium is important for the maintenance of cardiac electrical stability, and alterations in serum potassium levels, such as can be induced by diuretic drugs, can contribute to the development of cardiac arrhythmias. Assessing potassium levels via blood testing and increasing potassium intake via supplementation, if levels are found to be low, is an arrhythmia treatment consideration. In a study that enrolled 170 patients with symptomatic persistent atrial fibrillation, pre-treatment with intravenous potassium and magnesium improved the success rate of achieving conversion to a normal heart rhythm. Hawthorn is a fruit-bearing shrub whose constituents have been used since the 1800s to support the cardiovascular health. Modern scientific inquiry has shown that the hawthorn is rich in several antioxidant compounds such as flavonoids and anthocyanins, and that it can play a supportive role in several cardiovascular diseases. It's thought the hawthorn supports the heart and the vascular health via the modulation of ions like potassium and calcium, blood flow, inflammation and oxygen utilization, as well as by scavenging the damaging free radical molecules which cause the oxidative stress. In an animal model, an infusion of hawthorn extract reduced the number of arrhythmias compared to a controlled infusion following the experimental deprivation and the subsequent reinstitution of the blood supply to the heart, a paradigm that mimics some of the effects of a heart attack, known as ischemia reperfusion. In another similarly designed animal model, long-term supplementation with a standardized hawthorn extract was associated with a 6-fold lower incidence of potentially deadly ventricular fibrillation following the deprivation and the subsequent reinstitution of the blood flow to the heart. A 24-week-long human clinical trial involving over 1,000 patients with heart failure found hawthorn supplementation improved heart function, and it reduced the symptoms like fatigue and palpitations. Supplementation also increased the amount of time the subject's heart rhythms remained normal. Oxidative stress and inflammation have been implicated in the development of atrial fibrillation, and this is particularly true in the case of post-operative atrial fibrillation. Various studies have attempted to determine the usefulness of antioxidants in the treatment of atrial fibrillation. The beneficial effects of N-Acetyl treatment are attributed to its antioxidant and anti-inflammatory properties. Since oxidative stress has been implicated as a factor in post-operative atrial fibrillation, various trials have tried to assess the effectiveness of N-Acetyl in the prevention of the condition. An analysis of data from 8 separate trials that included a combined population of over 500 patients concluded N-Acetyl supplementation may effectively reduce the incidence of the post-operative atrial fibrillation. In a trial conducted to study the effects of N-Acetyl treatment on post-operative atrial fibrillation, intravenous infusion of N-Acetyl was compared to a group receiving a saline infusion. The post-operative atrial fibrillation was found in only 3 patients from the N-Acetyl treated group, when compared to 12 from the saline group. Vitamin C and vitamin E also exert a protective effect against post-operative atrial fibrillation by virtue of their antioxidant properties. An analysis of data from 5 clinical trials that examined a total of 567 patients demonstrated that vitamin therapy caused a significant reduction in the incidence of post-operative atrial fibrillation and all-cause arrhythmias, and this effect was independent of the type of surgery. There's also evidence of a synergistic effect between antioxidant vitamins and beta blockers. A separate study that enrolled 100 patients undergoing bypass surgery showed a combination of oral vitamin C, 2 grams on the night prior to surgery, and 2 grams daily for 5 days thereafter, and a beta blocker was more effective in preventing post-operative atrial fibrillation than the beta blocker alone. The incidence of post-operative atrial fibrillation was only 4% in the vitamin C group when compared to 26% in the control group. Vitamin C treatment showed similar benefits in another study where a group of 44 patients who received the standard treatment following the conversion to the normal heart rhythm, and they received either vitamin C or no additional treatment. The atrial fibrillation recurred in only 4.5% of the patients in the vitamin C group, when compared with 36% of the patients who didn't receive any treatment. Similarly, pre-operative treatment with vitamin E for 28 days, followed by vitamin C on day 27 to 29, reduced the incidence of arrhythmias in a group of 37 patients undergoing bypass surgery. Resveratrol is a polyphenol and is found in grapes and Japanese knotweed, with antioxidant and anti-inflammatory properties. An animal model revealed that resveratrol can attenuate inflammatory response and oxidative stress after myocardial infarction, which can lead to a decreased inducibility of ventricular arrhythmias. A preclinical study revealed resveratrol treatment significantly suppressed myocardial infarction-induced ventricular arrhythmias, and it improved long-term survival. Resveratrol acts by a variety of mechanisms, and it exerts its effect in a concentration-dependent manner. By inhibiting the calcium current, which reduces the intracellular calcium overload, or opening certain potassium channels. Coenzyme Q10 is a powerful antioxidant, and it's an important component of cellular energy production. A number of studies have revealed a therapeutic role for CoQ10 in conditions of impaired cardiac function, such as heart failure. Animal data has shown CoQ10 can exert powerful anti-arrhythmic action following the deprivation and the subsequent reinstitution of the blood to the heart. Several clinical trials have revealed that CoQ10 possesses anti-arrhythmic action in situations of impaired cardiac function or metabolic disease like type 2 diabetes. In a trial involving 27 diabetic individuals, CoQ10 supplementation was found to be beneficial in reducing premature ventricular concentration. A trial involving 2,500 heart failure patients found 3 months of supplementation with 50 to 150 milligrams of CoQ10 daily was associated with an improvement in arrhythmia signs and symptoms in 62% of the subjects. Another trial evaluated the effects of CoQ10 supplementation at 150 milligrams per day for 7 days preceding the scheduled coronary artery bypass graft in 40 subjects who were divided to receive CoQ10 or to act as a control group. Following the bypass graft, the CoQ10 supplementation was associated with lower markers of oxidative stress and significantly lower incidence of potentially deadly ventricular fibrillation. In a controlled clinical trial among 144 subjects who had a heart attack, 28 days of supplementation with 120 milligrams of CoQ10 daily was associated with a 2.6-fold reduction in the occurrence of arrhythmias. Moreover, subjects who were receiving the CoQ10 also exhibited less evidence of oxidative stress, and levels of other antioxidants such as vitamin A, C, and E increased to a greater degree following the heart attack in the group who received the CoQ10 than those who received the placebo. Rhodiola rosea reduced the incidence of ventricular arrhythmias, and it increased the ventricular fibrillation threshold in an animal model of heart attack. Preclinical research suggests the anti-arrhythmic effect of rhodiola might be due to the activation of opioid receptors. Experimental preclinical research has demonstrated pre-treatment with rhodiola improves several measures of heart cell health following an induced ischemic injury. For more on herbs, supplements, and natural treatment plans, check out my website.